Welcome to School Zone, the show all about your local school districts here in the White Mountains. I'm your host, John Larsen. Today we have two of our health techs from our district here in Show Low. One of them is Bridgett Massey, the other is Tina Stabenow. Welcome to the show.
Hey.
Glad you guys are here. If you would take a minute, Tina, we'll start with you. If you can introduce yourself, and then we'll go to Bridgett.
Hi, my name is Tina Stabenow, and I work at the Show Low Junior High School as a health tech, and we've lived in this community many years. I had 4 children graduate from the Show Low Unified School District, and I'm married to a pretty great guy.
Bridgett, tell us about you.
I'm Bridgett Massey. I'm the health tech at Whipple Ranch Elementary. I have 2 awesome boys that go there. They're in 1st and 2nd grade. I'm married to my husband. He's a great guy. And
how long have you lived here?
I've lived here for 20-some years.
About 20-some odd years.
Yeah.
Great. And your husband's from here, right?
He is, yeah.
So you're
husband's from
more
here.
or less native then.
Yes.
Pretty much. Well, good. I'm glad that you're both here. I appreciate you for taking the time to come and visit with us. I thought it was a great idea to get a couple of the health techs in, get a good point of view from the junior high and from the elementary schools, how things are going with the start of the school year, with the whole COVID crisis and everything. So I really appreciate you taking your time to do this with me. I'm grateful. So why don't you, if you would, just give us a description of your daily activities, your daily routine as the health tech at the junior high.
So I come in the morning and I start my morning in the office as a rule, and I help the ladies in there with kids strolling in a little late and stuff. And there are mornings as I come in, I have students who are not feeling well or have an injury from out in the playground. Our days go pretty fast and furious. And
on a normal day, how many kids do you see?
I can see anywhere from 15 to 30.
Wow.
Yeah.
So you are busy.
Yes.
You are busy. How about at Whipple?
Oh, yeah, probably anywhere from 20 to 40.
20 to 40?
Something like that.
Maybe sometimes a little more with the younger kids and...
Well, with the younger kids, yeah, you always have a tummy ache or
a little more attention needing.
Yeah.
Okay. Good. So what is the toughest, most demanding part of your job, Tina, when they're at the junior high?
Well, I think there's a lot of responsibility, and for me the toughest part is making right calls. You know, you just have to kind of juggle all the information and make the right call as to what a student needs, or what their illness might be, or what their needs might be. So to me, it's that responsibility of making the right call when you're taking care of them. So
can I ask you, I mean, I've known you for a number of years. You've dealt with all of my children.
I sure have.
Yes, you have. And it's their mom's fault, I promise. But, you know, I always felt really comfortable that a mom was there, and that your experience as a mom would, of course, translate into other people's children's and maybe what might or might not be wrong. So I've always been really grateful for that. What's the toughest or most demanding part for you at Whipple?
Oh, I think that, I don't know how to answer this one.
Is it the age, the youth, the age of the children? And
It's not. It's just a job. I mean, some days you have your easy days and you have your hard days. There's some days where you're just running, and you worry about the kids. Like, you get to know certain kids that, you know, come into your office every day for
more
meds
often
or
than
whatever.
Others?
Yeah.
Well, sure, you guys take care of meds for kids that every day have to have a certain med. So
that's true.
Yeah, that's pretty demanding to take care of that and house that. I assume we have a place we keep meds where
under lock and key.
Yeah, only you can get to them and whatnot. So I appreciate that. That can be demanding. So let's. I really want to talk about how we're faring with the startup with COVID. How was the situation at your school at the site that you work at in regards to COVID-19, Bridgett?
It's good. Our district has not had any positive COVID-19 tests.
Excellent.
So that is wonderful. But
Yeah.
the kids are doing pretty good. I mean, the mask thing was a challenge there in the beginning.
I'll bet, especially for the younger kids.
For the younger kids, it is.
I'm sure. Tina, what about it at the junior high?
I'm really excited how well things are going. I mean, we have sickness at the school. We always have sickness at the school, and it's the same kind of sicknesses we've always had.
Good.
We haven't had any reports of positive testing. The kids, the masks are a struggle sometimes. I think more so for some kids than others.
Yeah.
Overall, the kids are doing great wearing them. I just am really excited how well things are going. And the kids are happy to be there.
Good. I was going to ask later about the mask situation, but since we brought it up, we might as well talk about it now. I would imagine that the reasons for the kids at the junior high to struggle with the masks and the reasons for the kids at the elementary are different. I mean, I don't know how we would have ever possibly kept our 5-year-old with a mask on, or our 7-year-old with a mask on, and then our junior high kid for completely different reasons. You know, and so I'm glad to hear that things are going well. Have you had any real issues with the mask, Bridgett?
Our biggest issue is they lose them or they don't come to school with them.
All right.
We are going through hundreds of masks since the year started.
Okay. Well, how do we get the parents to help us out with that?
They need to send their kids to school with a mask. That would be a huge help. They're going to lose them. We understand that. They're going to leave them on the playground. We'll give them one. But if they could just send their kids with a mask, that would be extremely helpful.
Tina?
Yes, just teach them to put them in their backpack and keep them in their backpack so they always have them. But we have the same thing. Our biggest thing is, I forgot mine. So, you know, we're really putting out a lot of masks, which I'm sure in a bit is going to become quite an expense.
Difficult, yeah. So I think we're in a position now with this COVID crisis that life has changed.
Yes.
And this is one of the things that we're going to have to add to our toolbox, right? The kids are going to have a mask. I know for my kid, I've only got one left in the school district, but we have one in his backpack that stays there always, and then he's got the one that he's going to school with that day. And that way, if he runs, you know, if he loses that one or something happens, gets dirty or whatever, he can switch them out. So I think it's really important that our parents understand that this is going to be just like you're sending a kid with a pen or a pencil or an eraser or paper or a notebook.
That's what Mrs. Merrill says every day.
Yeah.
You brought a pencil to school, didn't you?
Yeah.
You got to bring your mask. Just the same thing.
I think that's where we're at in this situation. So I'm glad to hear they're doing okay, and I'm not surprised that we're struggling in a certain sense with that. So. Is there anything that you can tell me specifically about your building or the staff or the students that you guys are doing on a daily basis, considering COVID?
We are sanitizing multiple times. I mean, all the touch surfaces are being gone over multiple times a day. They installed, just in my school, 40 hand sanitizing stations, the pump hand sanitizer.
Are you going classroom to classroom and helping with that?
No, that's not something I'm doing
So
personally.
are we having the teachers are manning that?
The custodians.
Oh, the custodians, okay.
Oh man, they're doing a great job, and they're working hard.
They're busy. Yeah. Anything at the junior high?
So at the junior high, we switch classes, right? So when a teacher has a prep time or the classroom is empty for a period for whatever reason, our custodians are going in at that time and doing all the desks and all the surfaces. And just anytime a student leaves my health office, I spray it down and we clean it. And if we have anyone in there that's really, really ill, we clean it after they leave. Doing a lot of spraying and...
I'm assuming we have a lot of these hand sanitizer pumps in the classroom. Do we have them in the hallways or the dispensers? I know we've we've been blessed to get some of that stuff during this crisis.
The dispensers are in every classroom, as well as these bottles. We don't have them in the hallways so much because it's a fire hazard.
Right.
So
okay,
we don't
good.
put them in the hallways.
Well, we've thought that out, haven't we? Yeah. I haven't thought that out, but I'm glad
I
you guys
have 2 in my office alone, one by every door.
They've just been installing multiple ones this past week.
Same thing at the junior high? Okay.
Yes, and they have bottles, individual bottles in every classroom, and
great.
Yeah.
Great. How's the staff doing? Are they faring okay with all of this?
I think for the most part they're doing pretty well. They're doing the best they can, you know, with what they have, and it's what we have to do. So they're doing pretty good.
Tina, how's the junior high?
I think, you know, some of the staff might get nervous once in a while when there's a sick child around. Yeah. But we're going by the Navajo County guidelines and the orders from the state and making the best choices we can with the kids. So I think everyone has been well. All our staff seems to be well.
Good.
So I don't think...
Well, I think we're doing the right things so far, right? Yeah. So far, so good. So if we can just get a little luck on our side, we'll continue to...
Well, you can only do what you can do.
Right, right.
But, I mean, it's really going well, I think.
Good. I'm glad.
It is better than I expected.
What has this caused you to do differently than what you normally did? Or was this just a few minor adjustments that you had to make, or were you already pretty vigilant?
I think we were already pretty vigilant, but the only thing, we check sick kids every single day. Every single day I send at least 1 kid home for being sick. So the only thing that's really changed for us in our school is we do take every kid's temperature regardless of why they're in our office. They could be there for a Band-Aid, and we're going to take your temperature. Okay.
So you're going to screen them a little bit to try to catch something if it's there.
Yeah, we do that, and then also it's 36 hours. We used to send a kid home with, you know, a fever, vomiting, diarrhea, anything like that, and it was a 24-hour symptom-free before they could go back to school. Now it's 36 hours symptom-free.
Did we come up with that, or was that a guideline from the county or the state?
I think it's a district.
So the district decided 24 to 36?
Right.
Okay.
No, 36 hours. 24 is normal, kind of our normal standard. I believe the district expanded that to 36.
Good. Good. Great. That's good. So I think you just told me one of the things that you do, how things have changed since evaluating the kids now as opposed to before. Is there anything you're doing? Are you doing the same temperature?
Every student that comes into the health office is getting their temperature taken regardless of why they come in. Yeah.
Anything else that's changed like that?
Well, maybe if they're showing some of the symptoms that may come along with COVID, we might ask a little more questions than normal, you know, like have you been exposed to anyone recently, or has anyone been sick around you? Just a little more maybe questions toward that than normal. So when you're trying to screen them, are you asking them as far as symptoms? What are you asking for symptoms? Well, we have a symptom checker that comes from Navajo County, and it just kind of gives you some guidelines about, you know, coughing, how long have you not been feeling well, when did you start not feeling well. Are we asking for, like, do you have a headache? I assume, are we asking about respiratory, because it is, I know it is a respiratory issue. Know. You know what's crazy is almost all the symptoms are symptoms of everying else that we get at the school. So, you know. Okay, good, cool, good. So you guys are asking a few more questions. What I know that it's probably what you just said, the same things, but what is a kid going to present with symptom-wise that you're going to send them home? Is it the same as it's always been?
It is.
Is it? Okay. Because, I mean, a lot of the same symptoms of flu and You know, if a kid's got diarrhea, I know we're sending them home, those kind of things. So
fever.
It's just more of a, fever. So it's more of maybe a little heightened sense of vigilance as far as checking them out. And
it is, but you also have to use your own protocols too, because a kid can come in with allergies and they could have a cough and a runny nose and they can show symptoms, but they don't have a fever, they are not vomiting, they don't have diarrhea. So it's a lot of just making the call on whether these are symptoms or whether it is allergies. And sometimes it takes a phone call home to say, oh, hey mom, do they have allergies? And you'll get a long way with my school just because they are smaller kids doing it that way sometimes.
Great, so you have access to call mom and dad, and you do that on a regular basis when you need to?
We do.
That's great. Yep. That's great. I'm glad to hear that. I'm glad to hear that. As a matter of fact, I know I've received phone
I've had to call you several times.
You have. More than you want, John.
More than I'm going to let on to.
So you just told me that I was going to ask you about if they do get sent home, what was the period of time before they can come back? And you're telling me now from 24 hours to 36 hours symptom-free before you will allow them back into school.
No,
correct?
It's 36 hours. It used to be before COVID hit, it was a 24-hour symptom-free and they could come back. Okay. Now, as it sits,
straight
it's
up 36 hours. So they've got to be symptom-free for 36 hours before they're going to be allowed to come back.
Without any medication. You cannot give them Tylenol for the last 3 days.
Yeah, to cover the symptoms. Gotcha. Okay, great. So mom and dad need to know that.
Well, that's just for fever and normal. If anyone is suspected of being exposed, there's different guidelines, and that we use these from the Navajo County. So there's different guidelines, 10 days, and then
if we're talking
days,
COVID, we're doing the whole
so suspicion of that, or a waiting test, or been exposed, or positives, they all have a different
and we should probably let them know that we're not doing any testing on the kids. We're going to send them home. Mom and dad are going to take that with a personal care provider or the county or the hospital, however they'll end up getting that child tested. So
if they choose, it's their choice.
So if we look at this from a home perspective, if I've got a child and that child is not feeling well, what should mom and dad do when it comes to that point to keep that kid home and not even coming to school in the first place? Because there's no way getting around. As parents, we all work, we all have responsibilities, and we've sent kids to school not feeling well before. I've done it, my wife's done it, I'm sure we've all done it. But now we've got to a point where we've got to, again, change the way we do things. When do we say to ourselves we can't send that kid to school?
When they don't feel good. If your child does not feel good, do not send them to school.
Okay.
Especially right now. Yeah, because we just have so much more we're trying to cover, and we really want to keep everyone healthy because everyone wants to be at school. So I think there was a memo or some kind of announcement that went out before school started asking parents, if your child is sick, regardless, keep them home.
Yes.
Where on normal times, you might kind of, be a little hinky on that. And if they're just a little not feeling well, they would be okay. But keep them home if they don't feel well.
Yeah, and I think that we've made some adjustments in the district to help alleviate the problem if they're home for an extended amount of time. That's not going to cost them in the classroom. We've got ways to help them to continue to educate. If they, say they were out quarantined for COVID, we can take care of them while they're home and continue to educate. So we've made some special preferences for these kids to continue to be able to go to school. So I hope mom and dad aren't afraid of keeping their kids home. And I think it's one of the new things that we're going to have to live with is we can't send our kids to school sick anymore.
It's always that struggle about working.
It is.
It's hard.
It is. It's very hard. And I know a lot of times people don't understand that when they send their kid to school ill, it takes resources for the school to tend and take care of that kid and pull it away from other children and the education. So I hope we get to that understanding. I really do. Thanks for bringing that up. We talked about the kids and the mask requirement. I was going to talk to you about that, but you pretty much told me that it's a struggle and they're getting better, and hopefully this. You know, I used to live in Japan, and as a culture there, as soon as they feel any kind of illness going on, they put a mask on if they go out in public. And I think that maybe we're headed towards something like that, that they'll have to be part of our apparel. I don't know if that's the right way to look at it, but I know I've got a Notre Dame mask so that I look cool, you know.
I hope not.
When you cover up 3/4 of my face, I'm starting to look good, you know. So yeah, I'm hoping that masks will become more of a norm here. So what have they told us has to happen in order for the mask requirement to be rescinded? Have you heard anything?
Navajo County has to be below 5% positivity rate. For positive COVID.
But for an extended amount of time, do you know?
I'm not sure about the time length, but I know that if we get below 5%, and I want to say it's 2 weeks, but don't quote me on that.
I was thinking that was probably pretty close to there was a set
I don't know.
time.
Do we have to have the governor make an executive order? I'm not sure.
No, I don't think so. I think they've set those guidelines for us before school started. So, and we should say that we have met those. We're currently meeting those requirements, and things are going well in our county right now. So that's exciting. So we've just got a couple of minutes left. I really appreciate it, but I don't want to end this without hearing from both of you anything that I've missed, anything you want parents to know, anything you want the community to know, anything you want to stress again. Okay? Bridgett, is there anything you want parents to know that we haven't talked about, or do you want to stress something?
Keep your sick kids home and send them with a mask.
Okay.
That's
so keep your ill children home and send them with a mask. It's really important. Tina, is there anything above and beyond that, or you feel the same way?
Well, yes, I feel the same way. Keep your children home. There's options for classes when they're home and wear their mask. And yeah, I mean, I'm really excited how well things are going. And our parents, I'm going to say too, have been really great about, you know, we don't have entry into our office at all from the public without an appointment or something. But we have a little foyer, and Susan's been mandating that, and the parents have been really great about, you know, not being able to come in and signing the kids out in the foyer, and it's been working really well. Okay, great. Yeah. Great. Have I missed anything? No. Nope. Not that I can think of. Thank you so much for being here. I really appreciate you guys taking time. I know this is time away from your family, and I really appreciate it. I think we got some good stuff out there. I'm hoping that we'll get some parents that'll see this, and that we can continue to have some success at school as far as keeping this at bay and keeping the kids healthy. Yes. Thank you so much. I appreciate you. Appreciate you coming. Thanks for joining us here on School Zone, and we'll see you again soon.